Yes, hello everybody. Thank you very much for the invitation. Yeah, I was asked to think a little bit about how to convert hearing aid users to successful middle ear implant users and also somehow present our data regarding this. And when I started to thought about this topic, I thought, okay, let's bring together what do these two types of implants have in common and what's the difference. So the concordance or common of these implants, it's acoustic stimulation. We have an external microphone and the batteries are external mostly, and we have a sound processing system. But there are much differences between these two implants. We have on one hand the indication, it's mild to profound hearing loss in the hearing aid, it's mild to moderate severe hearing loss in the hearing aid. Then we have the pathology. In hearing aids, you wear it in the outer ear, you can have some low pathology, and the middle ear implants, you have it in middle ear and profound pathology. On one hand, you have the membrane as a stimulation, the FNT on the other hand, and the costs are also different. Hearing aids, the costs are lower, middle ear implants cost higher, but in Germany we have the case that hearing aids are only partially paid by the insurance company and the middle ear implants are totally paid, so it's somehow different. But if I look at this scheme, it's somehow full and complicated. Now, I try to use somehow colors for this, so we have these things are in common and they're different, but that's still some complicated. But then I thought that's maybe the reason why we need really good counseling for our patients for this successful transformation. And I think this is needed, and I will a little bit go into detail how we do this counseling. Then I thought, okay, let's take all this together and what's really important for the patients. And I think that's its indication, it's where this implant is worn and somehow who pays for the implant. All the other aspects are somehow not important for patients. And if you take away this payment issue, because that's probably different in the countries, we remain on these 4 parts. So we have the degree of hearing loss and the pathology. And somehow these parts influence each other. So we have this quadrant now. And if we think now of the patient's perspective regarding the hearing loss, so how can we counsel them? So in Germany, we have the indication for the hearing aid. It's like worse than 30 decibel in the PTA3 for the hearing aid, and the monosyllabic word understanding less than 80% in the better hearing ear. That's the indication range for hearing aids in Germany. On the other hand, in the middle ear implant, only the affected ear counts. So we have the classic coupling and the vibroplastic coupling. You know about, and you know these indication ranges. But then, if you think in the patient perspective about the pathology, so we have patients with, let's say, low pathology. I would mean it like this: tympanic membrane, it's intact, it has some scars, but it's good to be used for hearing aid. On the other hand, we have these big mastoid cavities, and in my opinion, you can use the bone conduction implant, but I think this is a case for a middle ear implant. But if you look at these two tympanic membrane, reconstructed tympanic membrane, it's not totally clear which is better for a hearing aid and which is better for middle ear implant. And then we come now to the, I would say, surgeon's perspective. What's now for us interesting? And I think for us, it's the status of the middle ear and the tympanic membrane is interesting. So how can this be? How we can use this for counseling for the patient? We have, on one hand, this well-aerated middle ears or mastoid. We have this non- or low-aerated middle mastoids. We have patients with no or only little previous surgeries, and we have this patient with pronounced previous surgeries. And this is somehow important also to counseling for the surgical aspect now. So you think in a well-aerated middle ear, it's easy to put an FMT, for example, here at the short process of the incus. And also in a non-affected middle ear by operation, it's easy to put like the FMT at the round window membrane or at the long process of the incus. But if you have this non-aerated middle ear, like this O-paced mastoids, it's difficult to find your way somehow into the middle ear to have a place for the cable. And you all know that in pronounced previous surgery, it's also difficult to place FMT. You have to bring it sometimes without visible about vision, for example, at the oval window niche. And if you take all these possibilities, then there's another aspect which is probably important for your counseling or for this procession to a successful middle ear implant user. It's a coupling efficacy. And this, we're using this a lot, can be monitored by the intra-op ABR measurements. We already started nearly more than 10 years ago with these measurements. At the first was an own-built system, but since 4 years we're using this acoustic AP system provided by Medal, and we've now measured over 120 patients with this acoustic AP. And for the analysis, we analyzed 2 different parts. On one hand, we have the coupler, so we have incus coupling or stapes coupling together, and then the oval window and the round window coupling. And there's a good correlation between the ABR and the bone conduction PTA4. So these intraoperative ABR measurements can be applied for all couplers. And now we have also analyzed the frequencies at 1 kHz, 2 kHz, and 4 kHz. We have a good correlation. The correlation is not so good at 500 Hz, but this is probably due to the less power of this FMT at 500 Hz. So I think this has to be taken somehow in account when you want to do a good surgery for middle ear implants, to use some intraoperative measurements. And if we conclude all this, there are many points for successful transformation of hearing aids to middle ear implants. I think you have to take into account the degree of hearing loss, what's better, what's worse, the function and the situation of the outer ear canal, the tympanic membrane, should be taken into consideration for your counseling. The funding issue has to be an aspect. The status of middle ear and the mastoid, it's important for your surgeon to say what type of implant can you apply, the surgical aspect, and I would recommend to use some measurements for measuring the coupling efficacy in VSB surgery. And probably also the earlier the better, so convert your patients early. And in the end, thank you very much for attention. A picture from Würzburg, not so big and famous like Dubai, but I think both cities were worthwhile to go do a travel. Thank you very much.